So is the strain on the healthcare system in Lagos State affecting patient safety? To answer this question, we have to understand the building blocks of a healthcare system. There are 6 main building blocks of the healthcare system. There's financing, there's human resources for health, there's leadership, there's essential infrastructure, materials, there's information technology, and there's service delivery. Now, the strain on the healthcare system affects all these building blocks. So let's take human resources for health as an example. The strain on human resources for health in Nigeria, and particularly in Lagos State, is extremely dire. First of all, we don't have enough medical schools or health care training institutions to graduate enough doctors, nurses, pharmacists, etc. Then the few that we do graduate, because of brain drain and seeking better opportunities in other climes, these individuals tend to leave the country in droves. As a result, we have a very low healthcare provider to patient ratio. The World Health Organization recommends 1 doctor to 600 population. But in Nigeria, we're strained at about 1 doctor to 10,000 population. And that is even in urban centers where we have more healthcare workers. Because of this, the few doctors that we do have serving the country are overworked, experience burnout, and this can impact decision making and as a result, patient care and patient safety. Let's talk about funding. According to the Abuja Declaration of 2001, every African country is to dedicate 15% of GDP to healthcare. Nigeria is trailing at about 4 to 6%. As a result, the healthcare system is poorly funded, leading to poor remuneration of healthcare workers, poor infrastructure, and this impacts patient safety because patients will come to healthcare facilities. Sometimes they don't have even healthcare workers to attend to them. Sometimes work tools are not available to see patients, to conduct investigations. This can cause delays, and delays can impact morbidity and mortality. Another key health care building block that is strained is infrastructure, medical equipment, supplies, and essential medicines. This building block has been poorly funded. As a result, our healthcare facilities are in disrepair. We don't have the right infrastructure to care for our patients. Sometimes we come to healthcare facilities, there's no power, patients have to be turned back. We have facilities where bed spaces are not sufficient to serve the community. Emergency rooms are at capacity. Patients come with emergencies and there are no bed spaces to accommodate those patients. Those patients sit outside emergency rooms, their conditions deteriorate, leading to increased morbidity and mortality, and as a result, patient safety. Therefore, the strain on the healthcare system, on funding, on human resources for health, on infrastructure, essential medicines and materials, greatly impacts patient safety. In addition, Lagos State is experiencing overpopulation, overcrowding, unplanned urbanization. As a result, the population that needs to be cared for completely always outstrips the resources available to care for that population. When you come to healthcare facilities, there are long lines of patients probably waiting for just 1 doctor to see them. And as a result, doctors may not spend enough time with patients. And this can greatly impact their ability to make diagnoses and ability to provide the right treatment protocol for the patients. This, again, impacts patient safety. So, the strain on the healthcare system, funding, human resources for health, infrastructure, essential medicines and materials, in addition to overcrowding, overpopulation in the state of Lagos, combined leads to increased morbidity, mortality in our patient population, and ultimately affects patient safety.